So this is a very exciting combination. This combination evaluates. It's a total oral therapy evaluation. So both oral ASTX727 in combination with the oral BCL2 inhibitor Venetoclax. We are quite excited about the study because so far the studies have included only parenteral hypomethylating agent in combination with the oral Venetoclax. But we all know that patients with myelodysplastic syndrome, high risk, especially, they are in need of, if they cannot get to transplant, they would need life indefinite treatment with the regimen or until they lose response. So that's for a longer time. So exploring this combination would allow us to provide a better quality of life in those patients who need a longer treatment regimen. So this is a phase 1 study. So basically this is phase 1/2 study, and we are presenting the phase 1 portion of it. It's a dose finding study. We evaluated 3 dose levels. ASTX727 is a fixed dose combinations, and it was given on day 1 to 5, and Venetoclax was given on day 1 to 14. And as I said, the ASTX727 is a fixed dose combination. We did not mess with that dose. And Venetoclax was given, Venetoclax dose was the one that was adjusted. So dose level 0 was 200 milligram, dose level -1 was 100 milligram, and dose level +1 was 400 milligram. And Venetoclax dose reduction was adjusted for their concomitant azole administration. In the phase 1 portion of the study, there were 9 patients who were enrolled. Dose level 1, it was 3 patients, and dose level 1, it was 6 patients. And there was no dose-limiting toxicity in the 6-patient lead-in. And this is a quite high-risk cohort because the median platelet count was 43,000, and this cohort was enriched with predominantly, the bone marrow blast count was 13%, which attests to the higher risk features of this subgroup. And the number of mutations which plays a prognostic role, the number of mutations in this particular subgroup was about 4 per patient. And as this is a dose-finding study, there was no 30-day or 60-day mortality, and we did not observe any nausea or vomiting. So that's a very particular thing which we are looking for, especially when we administer both these drugs in through oral administration. And myelosuppression was as expected, given that HMA and Venetoclax are known for their myelosuppressive side effects. The response rates were quite good. The response rates were 100%. And in dose level 0, 3 out of 3 patients had overall response rate, and as well as in dose level 1, 6 patients had 100% overall response rate. And 67% of CR or complete remission in dose level 0 and 17% in dose level 1. And what is more important is 3 of these 9 patients could get to transplant. To conclude, this total oral therapy with Venetoclax and ASTX727 appears safe and very well tolerated, and the overall response rate is 100% with encouraging overall survival with a very short follow-up. One caveat to remember is Venetoclax can prolong myelosuppression, so decreased duration of Venetoclax may facilitate faster count recovery.